So that's where we were in 2002. And here's the latest data. Now, we interpret this very cautiously as suggesting that the research impacts on the public use. Echinacea sales fell very promptly after the publication of the echinacea studies. The supplement industry also tracks the impact of this research on public use, and they certainly agree that the extensive media coverage of these studies does result in impact on sales. This is actually from the Nutrition Business Journal. That's the journal that is the trade journal of the dietary supplement and over-the-counter industry. And what you see here is that they noticed the main echinacea study was published in July 2005. They say it's lucky it was published in the summer when fewer people had colds, and they noticed substantially lower sales the following winter. So we believe that the public investment in this is yielding information that's important. We are always disappointed when the studies don't show the expected benefit, but we think definitive, rigorous answers to these questions are really important. And this is just to emphasize the fact that this research gets enormous media coverage. The public and the media are very, very interested in this research, more, I think, than some of the other areas of research the NIH supports. And one of the reasons people are interested in this is these are self-care decisions. So these aren't decisions where people are turning to their docs for the answer. These are things they're struggling with themselves. So the numbers tell us that these practices, particularly natural products, meditation, massage, manipulative therapies, yoga, widely used by the American public. Chronic pain, especially back pain, is the most common reason. Media coverage, public interest is very strong. And data on natural products from both our sources and industry sources indicates the public, there is public impact of the research results. So in spite of that, lots of people in the medical profession are not totally convinced that it's worth spending money on this. And certainly one of the reasons they're not is they say, well, none of it works. But I actually think some of these health practices are important and show promise and are interesting. I come to this with the perspective of being a kidney doctor and having taken care of real sick people surrounded with high-tech medicine. And I know how demoralizing and difficult that is for our patients, and have seen as I talk to people incorporating these approaches into their practice, how much, lots of testimonials of them meeting needs that are not well met by our current healthcare system. And so that's why I take very seriously trying to identify those practices that really have the biggest potential to help people either suffering with chronic disease or trying to stay healthy.